and then we go to the endpoints of the clinical trial, right? So you might have heard of this saying, enjoy the journey and not the destination. That's very true. We can enjoy these trial procedures and so forth, but clinical trials are a very expensive process, right? So we need to focus on the endpoint. What are we trying to get out of this clinical trial? So the central arrow is the primary endpoint. That's like the primary, enlightenment, as you might say, we might get from doing the clinical trial. And then the peripheral arrows are the secondary endpoints. Those are like secondary. So the primary endpoint is to confirm objective response rate. That means the objective, how the cancer responds to the drug as assessed by the investigator per RECIST. So RECIST is like a scheme used to gauge the response of solid tumors by measuring their diameter, right? RECIST. And then secondary endpoints are central nervous system response or objective response rate as per RECIST. So that is when this is a small lung cancer, but then in some patients it would have metastatized, that means spread to the brain. Then we measure the tumor in the brain as well and get objective response rate. And then time to response, that means let's say you give the drug at day 0 and then you wait day 1, day 2, day 3, day 4, day 5, still no response, day 5, day 6, day 7, and then you might take a scan at day 7 and then the cancer has gotten smaller. That means time to response, after giving the drug, the cancer response after 7 days, time to response will be 7 days, and duration of response. So day 7 it gets smaller, day 8 it even gets smaller, day 9 it even gets smaller, then it goes 10, 11, 12, 13, 14, 15, it keeps getting smaller. And at day 15 it stops getting smaller anymore. At day 16 it's stable. So that's the duration of the response. That means after the tumor response, the tumor gets smaller, the duration of time until it keeps getting smaller, right? That's the duration. So this is the RECIST criteria, response evaluation criteria for solid tumor. That's what RECIST stands for. So the measurements, let's say the patient has only one tumor, then you measure the diameter of that tumor, right? And then you use that as a gauge to see how the cancer responds to the drug. But if they have multiple tumors, you measure the diameters and add them up, right? So 100% is what's at the baseline before treatment. And of course we leave some leeway because small changes are not significant. So let's say the cancer gets bigger by 18%, still it's okay, right? But if it gets bigger than 20%, that means 130%, that means progressive disease. That means the cancer is getting bigger, larger and larger. Tumor is getting larger and larger. And then if it gets smaller than 30%, let's say the patient's tumor regressed to 66% of its original size, that is partial response. That means the tumor is still there, but it's partially responding. And some patients might be really lucky and they get complete ablation of the tumor. That is complete response. So this is a very nice diagram. So let's say the tumor, the sum of tumor diameter is 100 millimeter at baseline, and at the first after therapy, the first scan, right, after a month, it has regressed to 68 millimeters. That means it's confirmed partial response. It's more than 30% and it's getting smaller. And then after another month, you take a scan again and it's 45 millimeters. It even got smaller. So you compare with the previous one, and then with the previous one, if it's getting smaller, still it's partial response. And then on the third scan, at the third month, it's 56 millimeters. So it has gotten bigger, right? Because earlier it was 45, right? So it got it bigger. That means it's progressive disease. That means it's getting bigger. So then the doctor will say, hey, it's progressive disease. Then it responded to the drug until the second scan, second month. So the duration of response was 2 months. And then on the third one, it's not responding anymore because it's getting bigger. So the doctor might forget about the drug and he might use radiotherapy later on to save the patient, obviously, right? So that's how it's done. RECIST, response evaluation of solid tumors. So secondary response, secondary endpoints, you say have time to response, duration of response. Then you have progression-free survival and overall survival. So let's look at the diagrams here. So this is the overall survival. So you at day 0 before treatment, it's all the patients are surviving, right, at day 1, and then you start, that's where the clock starts, right, at 1, and then you count the number of months and the number of patients who are alive, right. It gets smaller and smaller along the way, and then you plot those two graphs for the drug and the placebo, and of course the patients will be passing away because it's a deadly disease, right. So you won't get 100%. So what we use is we check where is the point where 50% of the patient are surviving, right, overall survival 0.5, and then we see which month it is. So for the placebo it's 3.8 months. So at 3.8 months 50% of the patients are surviving, but for the drug 50% of the patients are surviving even at 5.2 months. So that means there's a difference. So then we say there's a 37% increase in the median overall survival. So that is what overall survival is. So this is how they do the statistics. You don't really need to know it, but appreciate it. Then you have progression-free survival. Progression-free survival means what number of patients for whom the cancer is not progressing. It's either stable or it's getting smaller, right? So what percentage? So at day 0, the clock starts and we plot from month 3, 6, 9, 12 and so on, right? So for the placebo, it goes down, progression-free survival goes down, and at 4 months, it's 50%, right? 0.5 people per patient survive without progression. And for the drug, it's very good news. Even at 11.2 months, 50% of the patients have progression-free survival. So you do statistics on this, and it's more than 100% change in the number of months for patients with over progression-free survival. So that's very good news, right? That's good news for us. So these are the secondary endpoints: overall survival, progression-free survival. So that brings to the end of the lecture. So to summarize, and we have endpoints for the clinical trial, which is what we are aiming to get from the clinical trial. Aiming to get from the clinical trial. That's this information we get from the clinical trial after doing all the statistics. Those are the endpoints. So for this we use RECIST for solid tumors. We gauge the size of the tumor and so on, and then overall survival, we have how many patients survive at every month. We compare the placebo against the drug, and then progression-free survival, the percentage of patients who survive without disease progression. Right? So that brings to the end of the lecture. Really take this into heart and read up more about it on Wikipedia, Google, you name it, right? Read up about it. Look at different protocols. There will be like snapshots of protocols on Google and so on. Read up and try to understand these different elements. And that's the end of this lecture. In the next lecture, we'll look at eligibility criteria. That means the set of criteria used to select the patients for the trial, right? So, ciao for now.